Good afternoon. Do you hear me? No. No? Okay. Hello? Okay. Good afternoon. Nice to see you here. My director, Haralambos Touloumis, is not able to attend, so he sends his apologies. But let me not waste time and call Professor Daria Smirnova or Smirnova. It's not professor. Assistant professor. Okay. Who will present performance deficits for action but not mental state, verbal fluency in schizophrenia spectrum disorders.
Thank you very much, Professor Tsopoulos, for this kind...
It's also not professor, it's doctor.
Oh, thank you. That, you know, we are kind to each other. Okay. So, dear professors, dear colleagues, first of all, let me express my sincere gratitude for the opportunity to be here and to attend and to contribute to this very important scientific event. My presentation or lecture is devoted to verbal fluency in schizophrenia as a potential endophenotypic marker of this disorder. In the first part of my presentation, I will be talking about the role of language in schizophrenia research. And in the second part of the lecture, I will be focusing on particular findings of our study, where we found that there is selective semantic impairment within verbal fluency, and that schizophrenia patients experience a difficulty in action verbs generation, but surprisingly not with mental state verbs production. So what is schizophrenia? As Spence called that it is one of the most extreme states that human beings can inhabit. ICD-10 states that schizophrenia is a fundamental disturbance of personality involving its most basic functions, which give the normal person a feeling of individuality, uniqueness, and self-direction. I would remind you the very famous quote by Eugen Bleuler, who wrote that schizophrenia is not a disease in the strict sense, but appears to be a group of diseases. Therefore, we should speak about schizophrenias in the plural. In his paper on subtyping of schizophrenia, Professor Arsen Jablensky wrote, schizophrenia is not a nosological monolith, but rather an assembly of syndromes structured into relatively distinct subtypes of this disorder. The course of this disorder is not inevitably associated with deterioration. 61.4% of patients had multiple episodes with complete or either partial remissions, while only 30% experience continuous disabling illness with serious deterioration. The findings related to social support, daily living, and community function cause serious concern because the majority of schizophrenia patients are unemployed, report difficulty in socializing outside their home, and 30% of patients live alone, are living alone. Indeed, schizophrenia is characterized by a variability of clinical phenotypes and extensive genetic heterogeneity. Despite the century of research, the multifactorial causes and biological underpinnings of schizophrenia and related disorders are still poorly understood. The professional psychiatric community is discussing now the research which posts that multiple biological pathways lead to similar symptoms. So this is the direction of endophenotype research. This is the quote from a National Institute of Health funded study published in 2016 by Brett Clements from University of Georgia, United States. Center of Clinical Research in Neuropsychiatry was established in the University of Western Australia in 1995, and the search of endophenotypic markers related to diagnostic and prognostic subtypes of schizophrenia is one of the most promising schizophrenia research directions today and the leading research direction of CCRN team. The Western Australian Family Study of Schizophrenia is an important and long-term project initiated in 1996 with the aim of deconstructing the heterogeneity of schizophrenia as a unitary disease and subtyping the clinical phenotype on the basis of its underlying neurocognitive endophenotypes. While the phenomenological core of schizophrenia is a profound alteration of the sense of self, manifested in thought and language abnormalities, impaired social communication, delusions, and hallucinations, we subscribe to the view that schizophrenia is first and foremost a cognitive illness, while psychosis is a secondary or associated part of it. Western Australian Family Study of Schizophrenia recruited families with more than one member affected with schizophrenia disorder, spectrum disorders such as schizophrenia, pure schizophrenia, schizoaffective disorder, schizotypal disorder, and acute transient psychosis with schizophrenia symptoms. The cohort of Western Australia Family Study Schizophrenia includes at present 557 schizophrenia probants, 439 first-degree relatives, and 445 healthy controls. So, Professor Jablensky and team discovered two subtypes of pure types of schizophrenia, cognitive deficit and cognitively spared. It was published already in 2006, and the research is continuing. And on this slide, I just would like to mention what is endophenotype, and just to remind you that endophenotypes are subsets of biomarkers representing measurable components unseen by the unaided eye along the pathway between disease and distal genotype. So endophenotypes associated with illness, but not part of its diagnosis. They're heritable, they're occupying the terrain between disease symptoms and risk genotypes, they are state independent, they are co-segregating with illness in families and found in unaffected relatives at higher rate than in the general population. Why do we pay attention to language studies in schizophrenia? Diagnosis of schizophrenia still remains primarily based on symptoms, on self-reported subjective experiences. There are few objective signs presented through thought and language disorder. Language represents both signs of impairments given in speech, in patient speech, and a tool to access psychotic symptoms of schizophrenia. Again, Bleuler wrote, we are forced to deduce most of the anomalies from the oral and written production of the patients. Primary symptoms of schizophrenia find their expression in language, but here the abnormality lies not in language itself, but in the way it has to say. Already Kraepelin described language phenomena in schizophrenia. You also remember all these famous quotes about derailment in the expression of thoughts in speech, disorders in connected speech, and confused syntax, derailments in linguistic expression form especially important domain in speech disorders of dementia praecox and influence in a morbid way the form of the speech. Also, Karl Kleist mentioned that there are multiple discrete types of schizophrenia, that the thought disorder is some kind of dysphasia, when comprehension is unaffected. The speech expression is similar to frontal motor aphasia, Broca's aphasia, and paraphasias are similar to temporal lobe aphasia, Wernicke's word amnesia. Also, Cameron identified the phenomena of acidentic thinking. He described over-inclusiveness of schizophrenia patients' speech, their metonymic distortions, or using such called word approximations. Ellen Chaik described in details one patient speech, and she concluded that language dysfunction is some sort of intermittent aphasia. Also interesting is the hypothesis by Tolving about the semantic hypothesis, it's named, and about semantic hyperpriming, increased retrieval and intrusion of inappropriate normal associations. Peter McKenna and Thomasina wrote about formal thought disorder, which is primarily a disorder of pragmatics, failure to use context meaning, or failure to take account of the needs of the listener. Nancy Andreasen was the first who introduced language criteria to DSM-3 classification. She described 18 symptoms of language and communication dysfunction in schizophrenia, and really we like this title, this name for this dysfunction, thought, language and communication disorder in schizophrenia. And among them you can see this symptoms of poverty of speech, poverty of content of speech, pressure of speech, distractible speech, derailment, incoherence, and others. And of course, not all of them are related to schizophrenia spectrum disorders, and they are associated with other psychotic experiences. This research by Andreasen and Groove showed that we could call it as the most pathognomonic language symptoms for schizophrenia, those like poverty of speech, like tangentiality, derailment, and incoherence. Language criteria of schizophrenia varied and has been changed over the editions of statistical classifications of mental disorders. So in DSM-4 we saw positive symptoms of the disorganization dimension, disorganized speech such as frequent derailment. Previously it was called topic shifting and incoherence, and negative symptoms domain with related to restrictions in fluency, like blocking, interruption of speech, and productivity of speech, like alagia. Previously it was poverty of speech and poverty of content of speech. In DSM-5 we have the basic criterion A, point 3 of the rubric schizophrenia, disorganized speech, frequent derailment, and incoherence. ICD-10 includes more symptoms of language dysfunction, such as neologisms, breaks, and interpolation in the train of thought, incoherence, irrelevant speech, and paucity in speech. I can't mention this famous paper by Professor Timothy Crow, who stressed the role of language in developing psychosis, and in particular schizophrenia. His famous paper published in 100 words called Psychosis is the price that Homo sapiens pays for language in the process of evolution. Yes, indeed, we have this destruction of reality. We have the world of objectives, we have the material world, and we have also the world of naming the objective things. So there is a chance to be lost between names and the things itself, what Professor Timothy Crow might mean by this also. Language abnormalities in schizophrenia are genetically determined. It is well known that clinical and affected relatives experience deviant use of language, semantic impairment, and communication anomalies, as Deborah Levy and colleagues posted in 2010. And it is also consistent with the disintegration theory of schizophrenia. Language and semantic, in particular semantic dysfunction, is a failure to integrate linguistic and related sensory motor, perceptual, and affective experiences and memories in the whole entity of the object representation in the mind. Leading impairments in schizophrenia lie in the field of semantics and pragmatics. So the key feature of deviant verbalization in schizophrenia is anomalous semantics. We can mention here different kind and different project design studies which concluded about impaired semantic fluency, abnormal semantic activation, and impaired use of context, difficulty noticing semantic violation in sentences, excessive semantic activation during the initial stages of word processing, semantic errors, and etc. I would also like to remind you normal aspects of conversational speech. By the way, it's my attempt to conversate with Krepelin in Munich. So, first of all, it's spontaneity. Utterances occur spontaneously, not only as a response to questions. Also, the normal trait of conversational speech, it's fluency, as non-fluent speech is halting and laborious, often with poor articulation. It is also a tone-taking, so speaker and listener take tones. It's not the monopolized conversation. It is mutual topic, so staying on the topic or focus, no strain or perseveration. It is comprehension. Each participant understands the utterance of the other, making sense. So speech that is not understandable despite adequate articulation indicates a cognitive problem of the speaker, and of course associated behavior, facial expressions, gestures, body language, conveying conversational information. Decline in verbal fluency is a characteristic finding in schizophrenia involving a combination of mechanisms, including the basic ones such semantic processing skills, difficulties using context, and executive dysfunction. Semantic fluency deficit has previously been already proposed as a potential endophenotypic marker in schizophrenia, but the majority of previous studies have focused on object words, e.g. nouns, rather than action words, verbs. There was one of the first studies by the team of Professor Arsen Jablensky and the leading researcher Professor Joanna Bedcock about action fluency deficit reported in schizophrenia spectrum disorders. They found that action fluency deficit is related to clinical symptoms of odd speech, constricted affect, and increased social anxiety, but not to hallucinations and delusions. So mostly to cognitive problems than psychotic experience. And with really a joint effect on social interaction skills. As you know, action verb fluency tasks is a very easy administered instrument developed to measure the verb retrieval ability, drawing on evidence of a dissociation in the neural system supporting the generation of verbs versus nouns. Indeed, common and proper nouns are primarily represented in posterior and anterior temporal regions, respectively, whereas retrieval of verbs relies on the integrity of frontal neural circuits. Agrammatic aphasics with frontal lobe compromise demonstrated deficits in verb retrieval despite preserved noun retrieval. In contrast, patients with anomic aphasia, temporal lobe dysfunction, demonstrated greater difficulties with noun retrieval than verb retrieval. A very interesting study was published in Nature in 2016. This is the semantic atlas of the cerebral cortex, which suggests that topographical differences in brain activation are driven by word meaning, so by semantics. Action versus object semantics, I would stress it, rather than grammatical class per se, like verbs versus nouns. Then there was proved the neural separability of semantic classes of verbs in the brain, so already within the verbs. So there are different neural underpinnings underlying abstract versus concrete verbs and high motion versus low motion verbs in normal population. The neural and anatomical systems involved in processing concrete action verbs, e.g. to run, to poke, for example, or abstract mental state verbs, e.g. to think, to desire, is still a matter of considerable debate. But processing action and mental state verbs involves dissociable cortical networks that are flexibly engaged in representing the sensory, motor, and affective features of actions and the abstract motives driving those actions. Besides semantics, lexical characteristics of words also influence the verb's performance. For example, word length. Shorter words are easier to produce than longer words. Also, there is a word frequency effect. Word frequency is the number of occurrences of a word in a linguistic corpus. So in healthy people, higher frequency verbs, so more frequent verbs, are recognized and produced faster and more accurately than lower frequency verbs. Also, there is a lexical